and thanks for watching our video. My name is Nicole Schramm-Saptya, and I'm from the Duke Institute for Brain Sciences. I'm going to tell you about our group's work with mental health and the justice system in Durham County. This work would not be possible without the efforts of my amazing co-leader, Maria Tackett from the Department of Statistical Sciences, and my collaborator, Michele Easter in the Department of Psychiatry. And also the rest of the team. We've been supported by the Duke DIBS Connections and Data Plus programs, which support undergraduate involvement. We've also had 2 graduate student project managers over the years and an army of really wonderful undergraduates who have helped with all this analysis. We've also been supported by funding from the Duke Office of Durham and Community Affairs. So this work has been done in partnership with all of these agencies around Durham, all of whom have a long-standing, really serious, dedicated commitment to improving the lives of the people with mental health issues, mental illness, who are involved in the criminal justice system. This is a long history going back to about 2006 of doing really concrete positive steps to support that population. When we came in, what we did was to take data and help them with data analysis. So we merged data from the Durham County Detention Facility with data from Duke Health. So we know the population that is going in and out of the detention facility and coming to appointments at Duke Health. None of this would be possible without the services of Duke Health's Analytics Center of Excellence, whose mission is to take health data and make it accessible for analyses like this. So our big goals were to inform our county stakeholders about the extent and severity of mental health issues that are present in the justice-involved population in Durham. Second, we wanted to assess the relationship between Duke Health use and interaction with the criminal justice system on the part of those involved. And ultimately, we want to build networks of collaboration to continue to improve outcomes for these most vulnerable members of our community. So the first thing we can say is that, not surprisingly, mental illness is highly prevalent in the Durham County Detention Facility. About 16% of people in the facility have what is known as a serious mental illness. And this is defined as either schizophrenia, bipolar disorder, or major depressive disorder. Another 25% in the detention facility have some other mental health diagnosis, and this group includes drug addiction, post-traumatic stress disorder, anxiety, depression, developmental delays, sort of a catch-all of all the other mental health diagnoses. 27% of our population in the detention facility had no mental health diagnosis from Duke Health, but another 32% were unknown or unmatched to Duke. So we can assume that the prevalence of mental illness in the facility is a little higher than what we've stated here. Even with Durham's long history of programs and services, what we find in our data is that we still have the most serious patients having the most difficulty. Those with co-occurring serious mental illness and substance use disorder remain the most likely to be rearrested. Those who are frequent users of the Duke ED are also more likely to be frequently rearrested. So we have a population of people that are cycling repeatedly through both systems. One of the things that was most surprising to us is that a visit to the Duke ED is associated with an increased likelihood of rearrest very soon, in fact, in the next month. So it looks like a visit to the Duke ED is a warning sign that things are not going well for that person. And very often the crime types that we're seeing people get arrested for are often low level, not always, but I think we have a real opportunity to help people that are committing low-level crimes and also cycling between both systems. So with that, our team's next steps are, first of all, we're going to be mapping using GIS to map neighborhoods of the arrestees versus health services to see, would it be possible for them to get services before they get into a crisis situation? We're going to continue to analyze the effects of specific policies in Durham and North Carolina. As we said, the policies have evolved and many improvements have been made over the past few years, and we want to know which ones are working and which ones might need to be set aside. And ultimately, as I said, we want to build collaborations and continue to think about things in a combination of the medical and legal system level. I would love if someone wanted to reach out and brainstorm collaborations in implementation science or systems analysis to think about how do we make medical and legal systems that cooperate together and have as both of their goals the best outcome for the people involved. So once again, I want to thank our supporters. We had a small grant from the Duke Office of Durham and Community Affairs. And as I said, our undergraduate and graduate students were funded by Data Plus and the DIBS Connections and Brain and Society program. So thank you so much for your attention. And I'm happy to receive an email, think about collaboration, hear any questions that you might have. Thanks for your time, and I hope to see you soon.